this person. I think it will be very important to know that it has different manifestation. It has different signs and symptoms. How does it show in a person's
so it varies from person to person, or?
Yes, it can vary from person to person, and it also has what we say a very long incubation period. So we can have people who have this disease, but they have no signs and symptoms at all. It's good to mention that once you have this bacteria, somebody maybe has transmitted to them, you have gotten from another person, it can actually take even from 6 months to 40 years.
40 years?
Yes, before you show any signs and symptoms. So one of the signs and symptoms we can say is that it is asymptomatic. Asymptomatic just means there are no symptoms at all. You have the disease, but you are not showing any symptoms.
So how can one know that he's suffering from the disease? Unless
now you're tested. Because there are tests that we can do, depending on the type of the test that is being done, we can know that you are actually you have the disease, or you are a carrier of the disease, but you have no symptoms. So that's very important for people to understand. Secondly, leprosy usually mainly affects the eyes, the nose, and the skin of the body. And then later it also affects the nerves. So most of the signs and symptoms will depend on the area that has been affected and also the extent. Because even the skin, the way it is affected by leprosy, we'll mention, and later we'll understand that presents differently, even if the skin had been infected. So in terms of the eyes, especially what we call the repromatous leprosy, is where you'll find that people, they don't have the eyelashes, they're out, and the eyebrow and the eyelashes have been affected. Then the nose, once it's affected, you might find some people it is disfigured. It is not the normal shape of the nose that was there. In terms of the skin, there are some people who will just have some pale discoloration. Like there are areas, patches in the skin, they are lighter than the other part of the body. In fact, some of them might be on and off, some might even disappear. There are others that it might be what we call lesions. Lesions are now more of, now they are swollen, small areas on the skin, also depending on the extent of the person. Then if it is the nerves that have been affected, usually these nerves, they die. This bacteria actually kills that nerve. So depending on that area, and you'll find especially on the area of the fingers and on the toes, or on the leg or the foot, you'll find that these people most of the time are disfigured. It's because their nerves have been affected, they have no feelings, and especially now if they're handling hot things, they might get burned without knowing. Okay. Yes. So the signs and symptoms will actually range from no symptoms to disfigurement and skin problems. Okay. Yes.
Now let's talk about how is it diagnosed.
Okay, in terms of diagnosis, this is one of the bacteria that is very difficult to do some diagnosis because of the way it is. As I mentioned earlier, one, it takes a very long incubation period, but also it has been shown the way it grows compared to other organisms that might grow within hours. It might take even 14 days for it to grow from one stage to the other. And this is important because one of the tests we do is sometimes we take this organism, we put them in what we call a culture. A culture is basically a medium that encourages any organism to go very, very fast. So if there is a normal organism that we are talking about, some of them you can see that they have grown in that dish. We actually call it a petri dish. You can see that it has grown and almost fills that petri dish maybe within 1 or 2 days. But this organism can take 14 days. So it is one of the ways that we don't use to diagnose. So the main common way that we actually identify this, it is by a method called Zil-Nelson stain. So we stain it, we color those organisms, and then it shows a particular coloration of red around blue. So we know that this is the bacteria. So that is the main method of actually diagnosis, that this is Mycobacterium leprae. That is the leprosy organism causing this disease.
Okay. Is there a specific age group or even sex that is more prone to this disease?
No, ideally,
can affect.
Yes, all age groups can be affected, but it will affect people whose immunity is lower, more than a person whose immunity is strong and it is ready to combat the disease, and also maybe to contain it, even if you have it, but it has been contained. So the categories of people who maybe their immune are low could be children who are very young,
yes.
The elderly, and then if you have any disease, especially chronic diseases that are affecting your immune, this could be cancer, this could be HIV, then you could be more prone to get this disease. Yes.
Okay, let's talk about the complications that are caused by this disease.
Okay. Actually, this disease, because of the nature of what it affects, it can actually lead to very severe disfigurement of the body, and loss of sensation of the nerve that has been affected. So you might find a person that if the nerves of the hands have been affected, this person will not have any sensation on those areas. And as we had mentioned earlier, if he has no sensation, if this person is cooking, especially with firewood, he might get burnt without knowing. This person might cut a part of his body without knowing. Then in some cases, the areas that are affected, it is painful, even on the skin. So this person will feel pain on the areas that where this organism is. So basically, most of the complication will be due to pain, lack of sensation, that is death of the nerve of the particular area. You might find this person doesn't have the toes, and usually it's because of the same thing. He is either injured himself or herself. They have been cut and he did not notice it. So you find that such people, they are very disfigured. They have parts of the body that are not there, and they do not look the normal shape of a person who does not have this disease.
You have talked earlier that it can affect the eyes, the nose, the skin. So for example, if it affects the eyes, with time, can it spread to other part, or it only centered in that area only?
Okay, usually for leprosy, it will affect the area of the eyes, the nose, usually we say the cool areas, and the skin. So the skin will be disfigured, will not have the normal shape. You might also have swellings on the body. The person might have several swellings on the body, these granulomatous lesions. Then you, because of the sensation, so the organism beside these areas will affect the nerve, but we know the nerves are all over. So it is possible that any area of the body will be affected, looking at which nerve has been affected.
Okay, now Dr. you have talked about the causes, the symptoms, and also how can we best identify what causes a leprosy. Let's take a first break. When we come back, we'll take it from there. Stay tuned.
Horizon TV, the beacon for the nation.
Dear viewers, in case of any feedback, advice or complaints regarding our programming, contact Horizon TV on 0798 974747 or our live call-in number 0754 707 707 or email us at info@horizontv.co.ke.
Horizon TV, the beacon for the nation.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
Furaha ya nyumba ni familia, na furaha ya familia ni uwepo wa chakula kitamu. Kwa mapishi matamu ya aina mbalimbali, usikose kuungana nami Mariam Salim ndani ya idhaa ipendayo Horizon TV.
قال تعالى في محكم تنزيله بعد أعوذ بالله من الشيطان الرجيم.
Ninasaha kutoka pwani.
هذا الدين قال الله قال الرسول قال الصحابة هم أولو العرفان. انتهى.
Ili kuongoza kwenye njia iliyonyoka.
Sikizeni hadithi hii ya Mtume alayhi salatu wasalam.
Hakuna atakayeweza kumfungia mtu mlango ambaye Mwenyezi Mungu aliyemfungulia.
Kuimarisha imani yako.
Thabbit qulubana ala dinik wa ala ta'atik.
Ungana na mashekh wetu kutoka pwani kwenye mimbar.
Mimbar zinamwakilisha Mtume sallallahu alayhi wasallam.
Ni Jumamosi na wakati saa 3 usiku katika Horizon TV, runinga uipendayo.
Uislamu ambao ni maarufu kwetu sisi ni Uislamu ambao ulioletwa na Bwana Mtume sallallahu alaihi wasallam.
Ni risala alotuachia mtume wetu mtukufu, yenye kutuongoza kwenye njia ya kumridhisha Muumba na kujenga imani zetu.
Na risala hii haikuletwa ila kwa mtume wa mwisho vile vile ambaye ni Mtume Muhammadin sallallahu alaihi wasallam.
Ni mirathi ya mitume inayotupa mwelekeo kwenye dini ya Kiislamu. Ungana na Sheikh Saad Ahmed upate kufahamu ujumbe alotuachia mtume wetu sallallahu alayhi wasallam kila siku ya Alhamisi kwenye Horizon TV.
Kuna faida gani twapata tukimjua Mtume sallallahu alayhi wasallam?
Nabii mwenye ushawishi mkubwa duniani.
Tukizikwa tukitiwa kaburini, tutaulizwa haya maswali matatu: man rabbuk, ma dinuk, man nabiyuk.
Sheikh Jamaluddin anakupa simulizi.
Huwezi kumpenda mtu usiyemjua
na kutambua sunna zake,
lakini ukimjua na ukimtambua Mtume Muhammad sallallahu alaihi wasallam, mapenzi yako yatazidi.
Ufahamu Rasulullah, familia na maswahaba wake. Tazama sira ya Mtume kila Jumatatu saa 1 jioni kwenye Horizon TV.
Uislamu ni dini yenye mpangilio ulio kamili, na taratibu zake humpa fursa kila mja kuifahamu na kuelewa.
Muislamu yoyote lazima achukue jukumu la kuifahamu dini yake, kuanzia kwenye shahada, ashhadu, nakiri kwa moyo,
kisha usafi wa kimwili.
Hapo ndipo huanza safari ya kumwabudu Mola wake.
Usikose kujiunga nasi kila siku ya Jumamosi live kwenye kipindi Ufahamu Uislamu ili ujifunze mengi usiyojua kutoka Horizon TV.
Horizon TV, the beacon for the nation.
Assalamu alaikum once again. Welcome back to a second part of the show. This is Stay Healthy, and today's topic it's all about leprosy. Daktari, before we went for the break, we talked about the causes, signs, and symptoms. Now let's talk about the types of leprosy.
Yeah, thank you very much. I think basically the types of leprosies, they're categorized into 6. And these 6 categories is related to the extent of infection and the extent of signs that it shows. So the first one, we call it intermittent. This is basically, person shows some discoloration.
On the skin?
On the skin.
Okay.
They're actually on and off, and they don't have any pain, so they can actually sort of resolve or heal on themselves. So the person just sees there's some discoloration in some area, and they disappear actually sometimes. Then we have the tuberculoid leprosy. These actually look like swellings on the body. They are small swellings on the person's body. Then the extreme, the other categories actually are in between these swellings, how much they are, the discoloration, but the extreme, that is the 6th one, is where we call it lepromatous leprosy. In these, the persons, the swellings are more, the discoloration is more, the nerves have been affected more. So this person is actually on the extreme side of the signs and symptoms because of the infection of this disease or this bacteria. Yeah.
If, for example, Daktari, one doesn't notice that he's suffering from leprosy, and if left untreated for so long, can it be fatal or cause other complications?
Yeah, I think the main thing that leprosy causes, if it is left untreated, is that it will affect your nerves. And depending on the area of your nerve that has been affected, and usually with the extremities, that is the fingers and the toes, they get disfigured because of either the loss of sensation leads you to harm them, or for them to be either burnt or them to be cut without you noticing. So the extremity will be in terms of, one, the extremities of the body. They have been disfigured because they have now been disfigured because of one reason or the other. In terms of the other areas, if it's not at the extreme, you'll have a lack of sensation. The other thing is that you might have pain, especially on the skin. So it is ideally because there is management and there is a cure for them, you get early treatment so that you do not get to the complications.
For example, if it affects the nerves, can it be reversed later on, maybe after you seek medication?
Currently, if the nerves are damaged, there isn't much we can do about it. So it almost looks like it'll be a permanent damage for that nerve. But if it is caught at a certain stage, it will prevent the progression of either that nerve or that area being affected.
You have talked earlier that it can leprosy can affect different part of the body. Let's talk about the skin. How can you differentiate leprosy from other skin conditions?
Okay, some of the skin conditions will actually have the discoloration that we have talked about. There are some of skin conditions will actually also have these swellings. And some of this skin condition will also have some of the pain that we are talking about. Really, some of the skin condition will affect the nerve. So, one, any skin problem and that it is associated with a nerve problem, loss of sensation, now you cannot feel pain, that is more likely to be leprosy than any other skin diseases. But in terms of if it is discoloration, you might need now to do a skin test, especially if a dermatologist is looking at you, and they have some skin tests to differentiate. Some of them could be this discolored skin patches could just be fungus, so they can differentiate on the same. For the leprosy itself, for you to identify it, as we had mentioned earlier, you need to do the nail cell stain test so that you can actually know this is a Mycobacterium leprosy. So it will be more important for you to do a skin test, and also for somebody who's an expert in skin diseases, especially a dermatologist, to look and to give you the diagnosis. Yes.
Let's talk about leprosy if it's affect a certain part of the body, let's say the eye, and it's left untreated. Can it turn cancerous after a longer time?
No, usually it will not turn cancerous, but most probably there will be permanent damage to that area if it was not curbed or it was not gotten earlier for it to be treated and managed, so as to prevent that bacteria to do further damage, especially to the nerves of that area. Yes.
Now, after being diagnosed, how can you best manage it?
Yeah, I think the best thing for you, if you've been diagnosed, depending on the extent, one, especially to do with the disfigurement, it's possible that currently issues like plastic surgery, it's possible for you to be put back or bring back the shape of that particular area. The other thing will be actually to put on protective clothing or wearing, especially to do with the feet. You need to wear shoes or that are protecting the whole area, especially if they already had damage, so that there is no further damage to the same. Then basically you need to also to live in places that are well ventilated and aerated. We had mentioned earlier, we know that the transmission, the spread, is through airborne droplets. So whenever you're living with people, especially in closed areas, there should be well ventilation, that is have wide windows, and more importantly, if it's possible, that the windows they have opening on opposite side, so that there is circulation of air. Then basically, good nutrition for you to have a good immune will be very important.
Okay. For example, if one of the family members is affected by leprosy, like you said, it's airborne, how can you take care of them in the same building, or you have to isolate them?
Before treatment, it will be advisable for the person to be isolated and have mechanism that one will reduce the spread of this organism. Currently we understand, or we have been using a lot of masks, so it's important for those people to put on their mask. We have mentioned the issue of ventilation. It has to be there. If the people can be apart from this person, especially about 1 to 2 meters, very importantly, and if they were to come closer, they make sure even them they're putting on mask, they're well protected when they're dealing with him. But the earlier this person is taken to the hospital to be managed and given medication, the better, because once you are on medication, it's unlikely that you'll be spreading the disease. Yes.
So is it curable? And if yes, how long does it take one to recover from it?
Yes, we can say it is curable in terms of you'll cure, you'll stop the disease from spreading. The only problem will be if there were already any damaged parts of the body. Those ones will not be able to be repaired by the drugs. So basically, once you start the medication, which you can take about 6 months, you should actually be healed.
Okay, let's talk about the misconceptions surrounding this disease.
Yeah, I think the main stigma about this disease is it is associated with people who are cursed people who are been either outcast because of one reason or the other. And I think it has been an historical thing. It has been also on the back of the religious aspect that these people were isolated, these people were moved away from the community setting. So it is actually associated with the negative aspect of community understanding. So you'll find that most of these people are stigmatized. They are actually more psychologically traumatized because they are moved away. And it is mainly because of lack of understanding of what actually causes this disease and the progression in terms of once you are infected, that is what causes, for example, the disfigurement of the fingers. It causes you to also, your toes to be disfigured because of the effect of lack of sensation. So I think there's a lot of stigma on the same. There is little awareness. Many people actually do not understand or have not heard actually of leprosy. So it is important for these messages to go out. It's important for people to understand more on the issue of this. And also I think it must be important for the health workers to be putting the messages about leprosy outside there.
About the stigmatization, most people, like you said earlier, believe that once you suffer from this disease, it's like you are cursed. So people who are suffering from leprosy fear in talking about it because they don't want to be discriminated by the society. So what's your advice on that?
Yeah, I think more importantly for the patients, for them once to understand the condition itself, for them to be told it's a condition, it's a disease like any other, and that it can be managed. Once they understand and they accept that this is a disease like any other, they now need to be able to live with it as a disease, as a condition, but also get the necessary support, whether it is counseling if it is needed, whether it is a treatment when it's needed, and then follow-up rehabilitation, because some of the condition or the complication, they might need a long-term rehabilitation, whether it is in terms of repairing or doing plastic surgery of whatever areas that have been affected. So they need to be followed up. Then later they can actually pass this. They can be champions to the other communities that make them understand about the disease.
Okay, we have talked about the complications of leprosy and also the similarities between skin disease, other skin disease conditions, with leprosy. Let's take our second break. When you come back, Daktari will give us more insight about this disease. Stay tuned.
Horizon TV, kurunzi ya taifa.
Dear viewers, in case of any feedback, advice or complaints regarding our programming, contact Horizon TV on 0798 974747 or our live call-in number 0754 707 707 or email us at info@horizontv.co.ke.
Horizon TV, the beacon for the nation.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria sala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi
ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
Furaha ya nyumba ni familia, na furaha ya familia ni uwepo wa chakula kitamu. Mapishi matamu ya aina mbalimbali. Usikose kuungana nami Mariam Salim ndani ya idhaa ipendayo Horizon TV.
قال تعالى في محكم تنزيله بعد أعوذ بالله من الشيطان الرجيم.
Ninasaha kutoka pwani.
هذا الدين قال الله قال الرسول قال الصحابة هم أولو العرفان انتهى.
Ili kuongoza kwenye njia iliyonyoka.
Sikizeni hadithi hii ya Mtume alayhi salatu wasalam.
Hakuna atakayeweza kumfungia mtu mlango ambaye Mwenyezi Mungu aliyemfungulia.
Kuimarisha imani yako.
Thabbit qulubana ala dinik wa ala ta'atik.
Ungana na mashekh wetu kutoka pwani kwenye mimbar.
Mimbar zinamwakilisha Mtume sallallahu alayhi wasallam.
Ni Jumamosi na wakati saa 3 usiku katika Horizon TV, runinga uipendayo.
Uislamu ambao ni maarufu kwetu sisi ni Uislamu ambao ulioletwa na Bwana Mtume sallallahu alaihi wasallam.
Ni risala alotuachia mtume wetu mtukufu, yenye kutuongoza kwenye njia ya kumridhisha Muumba na kujenga imani zetu.
Na risala hii haikuletwa ila kwa mtume wa mwisho vile vile ambaye ni Mtume Muhammadin sallallahu alaihi wasallam.
Ni mirathi ya mitume inayotupa mwelekeo kwenye dini ya Kiislamu. Ungana na Sheikh Saad Ahmed upate kufahamu ujumbe alotuachia mtume wetu sallallahu alayhi wasallam kila siku ya Alhamisi kwenye Horizon TV.
Kuna faida gani twapata tukimjua Mtume sallallahu alayhi wasallam?
Nabii mwenye ushawishi mkubwa duniani.
Tukizikwa tukitiwa kaburini, tutaulizwa haya maswali matatu: man rabbuk, ma dinuk, man nabiyuk.
Sheikh Jamaluddin anakupa simulizi.
Huwezi kumpenda mtu usiyemjua
na kutambua sunna zake,
lakini ukimjua na ukimtambua Mtume Muhammad sallallahu alayhi wasallam, mapenzi yako yatazidi.
Ufahamu Rasulullah, familia na maswahaba wake. Tazama sira ya Mtume kila Jumatatu saa 1 jioni kwenye Horizon TV.
Uislamu ni dini yenye mpangilio ulio kamili, na taratibu zake humpa fursa kila mja kuifahamu na kuelewa.
Muislamu yoyote lazima achukue jukumu la kuifahamu dini yake, kuanzia kwenye shahada, ashhadu, nakiri kwa moyo,
kisha usafi wa kimwili.
Hapo ndipo huanza safari ya kumwabudu Mola wake.
Usikose kujiunga nasi kila siku ya Jumamosi live kwenye kipindi Ufahamu Uislamu, ili ujifunze mengi usiyojua kutoka Horizon TV.
Horizon TV, the beacon for the nation.
Assalamu alaikum. Once again, welcome back to our third and final part of the show. This is Stay Healthy, and today's topic is all about leprosy. Daktari, before we went to the break, we talked about the complications and also similarities or difference between leprosy, if it affects the skin, and other skin conditions. Now, like you said earlier, that most people are not aware about leprosy. So what is the government doing?
Leprosy, currently in the government Ministry of Health in Kenya, it is under the program that is called a National Leprosy TB and National TB and Leprosy Program. So there's actually a whole division handling in the same. And in this division, they actually associate, or their main mandate is actually to come up with the formulation, development of the policy documents on the same. This will include, they have strategic framework, how to deal with this disease. They will have a communication, social mobilization document on the same, so that they can actually have health education and awareness to the people. Then they also have the management structures for the same. This will include the standard procedures on how to manage the same, but also the curative aspect of it. That is, what are the drugs that are needed to heal the same, and also at the facility level, what is the expertise of the people who need to be trained, need to be oriented, so they can actually be able to diagnose the same. Then the facility or equipment that are needed, especially the laboratory equipment that is needed, they'll make sure that they are available, and then to let people know that actually they can come to the facilities and they can be managed. So basically that division is involved in how we can best manage leprosy. Then they also several times they orient or teach the health workers in terms of updates on the same, whether there are new updates in terms of management or treatment for the disease. And then they also go out with linking or with the association with the other structures. For example, the community health volunteers, they will go to the communities and inform them about the disease, and also that if potentially people think or suspect they have the disease, they can actually go to the facilities and be managed accordingly.
Now you've talked about like people advising people to go to the facilities in order to get assistance once they discovered like they're suffering from leprosy, but most people fear to do so just because maybe the cost is so high. So can it be cured, can it be treated freely at the hospitals, or if not, can one use the NHIF cards, or what are the other means?
Yeah, the management basically is at free of cost, and yeah, we know with the NHIF actually it will be covered completely. So I think there shouldn't be the fear of about the cost implication of the management or the treatment of the disease. So these can actually be managed. We know that the government has put maybe specific specialized areas like the Alupe Health Center area where usually it is managed. The government is also working closely with other research institutions like the Kenya Medical Research Institute, KEMRI, in Kenya, so that it can actually try and get the best understanding, get the best management and treatment for the same. So it is manageable. People should not fear the cost, and it can be treated.
Earlier, you have talked about the community health workers which are involved in mobilizing people regarding this disease. So what are other parties apart from them who are involved in managing this disease? Yeah,
I think as a government, they actually have a very important strategic thrust or objective of working with the other partners, with the other stakeholders. These including one, the community himself has an important stakeholder in terms of what they can do, what they should do. But there are also other partners that we call developmental partners and implementing partners that support us, one, in even coming up with the documents, the policy documents in the management of leprosy. They also help us in the management, so in the implementation that we are doing in terms of putting up the infrastructure to deal with the same, in terms of the human resource to put the same. If there is an element of commodities and equipment that is required, so there are other partners that really support us in the same. And then there's also the aspect of the health information management, where currently, besides not just taking the data, but also putting it in a, if we can say, in a digitalized form that can be easily be managed. They can do analysis easy, and it can help in the planning. So most of our partners support us in these areas in terms of digitalization. So the government actually works with other partners in several areas so that we can manage the disease.
Like you said earlier, most people are being discriminated just because people believe like they are cursed, just because they are suffering from this disease. Do you think it's necessary for them to seek counseling for their mental health?
Yeah, it will be important, especially for those who have not managed to accept and live with the disease. It means that they still either they are in denial or they're being affected by the associated stigma of this disease. So I think counseling and seeking mental health assistance, it will be important, whether it's from our counselors, from our psychiatrists. It will help them, one, to deal with the situation, live with it, and also go out as champions and live with the condition. So it could be important at this stage.
Any advice to our viewers before we finish?
Yeah, I think it is very important for us, as we had in the discussion area, to understand this disease, and more importantly, how it is spread. And we had said that it is spread through the air. It is air droplets. When somebody is coughing especially or sneezes, these droplets can transfer. It can move those Mycobacterium leprae to other people. And if it gets to other people, especially through their nose or their eyes, there are more chances that this person can get. We know the living condition is very important. We need to live in spaces that there is well ventilation, the aeration is good, and also if one suspects has this disease, looking at the signs and symptoms that we have discussed, is good for one to seek medical attention as soon as possible.
Daktari, thank you so much for finding time and joining us.
Thank you, shukran.
Well, our viewers, that marks the end of our show today. I hope you have benefited from our discussion. Join us next week, same time, as we discuss another topic. On behalf of my production team, I've been your host, Mariam Salim. Ma salam.